So, hi, good afternoon, everyone. I'm still Orsolya Gresits. Here I have some progress because I've started my residency since the last progress report. And I really want to work in a healthcare system where we implement the scientific research results quite quickly into the daily clinical practice to provide the best possible treatment to our patients. To achieve that, I want to contribute to high-quality research to improve cerebral palsy treatment. I have two projects in this program. The first one is called No Evidence of Functional Benefit After Upper Limb Botulinum Toxin Treatment in Children with Cerebral Palsy. Here we have cerebral palsy patients, which is a rather a condition than a disease. It's quite frequent, and most of those patients have increased muscle tone. It's called the spastic subtype. That's needed to be treated because it's painful, bothersome, and leads to further complications on the long run. There's one really good treatment option for that, injecting those spastic muscles with botulinum toxin A. That's the very same procedure used in facial botox and so in beauty treatments. But here we inject the spastic muscles of those children. It's widely accepted, used for almost 3 decades. And still there are some questions about it, mainly about indications. And we still don't know if it's beneficial from the functional side, especially when it's used on the upper limb. So that's a graphical abstract. I try to summarize what we did. We did our we did our systematic search, and we're searching for RCTs where only children with spastic cerebral palsy were included, and they were randomized to a treatment group where upper limb botulinum toxin was given, and to a control group where no BONT-A was given. And we extracted data on upper limb function, general body function, lie quality, spasticity, muscle tone, goals, pain, adverse events, and the parents' opinion on the results. We could include 13 studies with almost 500 patients, and I have 4 results to mention. The first one is about the muscle tone. Botox was working because kids in the Botox group had better muscle tone during the treatment. In terms of function, there wasn't any difference between Botox-treated and not treated groups. In terms of preset goals, Botox-treated kids did better. And when the parents' opinion were asked, also the Botox-treated groups did better. So we have positive subjective ratings, but no functional gain here. Yes, I have some forest plots because we like to see forest plots in this program. The first one is an example about the decrease in spasticity. As you see, the upper half was measured during the toxin effect. There is an effect which returned to 0 after the effect vanished. The second one is also an example. It's an upper limb functional measurement shown here. There's a minimal, not significant, not even clinically relevant change in this graph. Let me move to this goal achievement. It was measured by the goal attainment scaling T-scores. It's a quite complicated measurement, but better, so higher scores means a better goal achievement. As you see, Botox-treated groups did better. And the very last results right from this project is about the parents' opinion. They were asked how they see, so if they think their kids improved or not. And we calculated odds ratios on them. As you see, odds ratios are quite high. 2 weeks after the injection, also 3 months, and even 6 months after the injection, there's a significantly better odds ratio of having an improvement with botulinum toxin. Yes, so the strength of this work is that it's the most recent and comprehensive meta in this field, and we had very similar intervention process all across these 13 articles. And also there are some limitations to note, that there was different measurement methods used, so it made us really hard to pool the results. Also, we had to deal with the different data reporting practices. Some articles were using means, not standard deviations, plus so medians, not means. Some were reporting not numbers, but just stated that they improved and things like that. And also there's blinding problems in botox studies, because no matter how hard you try, one group will have a decrease in muscle tone, the other not. So the patient allocation reveals itself in a couple of weeks after the injection. That's already, I mean, I said already everything from this slide. And this one is submitted to the third journal, Developmental Medicine and Child Neurology. Last week, we had some questions about minor methodological revisions. I'm doing that and submitting it again to this journal, hopefully soon. Let me move to my second project. Does femoral derotation osteotomy improve gait in cerebral palsy? Here we have the very same patient population. The ones who are able to walk will develop some gait difficulties over the time. One really common is called the intuing gait. There's a quite big surgical procedure called the femoral derotation osteotomy to improve that state. So you see here what's done. It's a routine procedure, but still quite a big procedure. And with this work, we wanted to clarify if this surgical procedure has a positive impact on the gait itself or just brings better cosmetic function. That was our PO. We ended up with 44 different full texts. It was from 29 different studies or databases. I have some results to show you here. That one is about the hip rotation improvement. It was measured with three-dimensional gait measurements. So practically it shows that the kids treated with this procedure had better hip rotation during walking. The upper half, that was the short term, so 1 or 2 years after the procedure. That's the midterm, 3-4 years, and that's 5+ years. So actually this correction was maintained. That's almost the same, but with foot progression angle. That's the angle between the direction of the movement and the direction of the foot. Here, very similarly, we see better so corrected gait, and that's good. That's gait scores. That was actually our primer outcome of interest. Here we have 5+ years and 1 or 2 years after the operation. There were different gait scores used. They are really similar, but not the same, because that's why we had to use standardized mean differences here. There's some positive tendency. We have to decide how to discuss that. One thing I want to note, that only this group is so that's the only one showing no improvement. All the others are. And that's quite of interesting, because when we see the seriousity categories of cerebral palsy, most of the kids are in this 2, but the only one which were showing no improvement are more serious, so 3 and 4. But the rest, where there was an improvement, they were all in category 1 and 2. So that would be quite an interesting thing to discuss. And we still have statistically significant improvement in terms of step widths. So kids with this operation walked almost 3 centimeters closer. So the legs were almost 3 centimeters closer to each other when they were walking after the operation. And that's quite good, because that correlates to balance and gait stability. So the strength of his work is the large data pool, almost 3,000 patients. And the most important limitation to know is that in most cases, we had multi-level surgeries with FDOs and not just FDOs. So, and that's it. Thank you for your attention.
Thank you very much. Orsi, I would like to ask you, Botox was a single therapeutical option, or how much was the repetition time, if not?
Thank you for your question. In some studies, there were repeated injections, but we could only assess 1 single treatment shot. So those results are from 1 single shot.
Thank you very much.
Thank you for your presentation. It's really nice. My question is about the first part. So you mentioned that botulinum was used for decades in the treatment of cerebral palsy. And as far as I know, it's a very potent neurotoxin, and it blocks the release of acetylcholine, which may cause muscular atrophy. Then what is the rationale behind using it from the first place?
Yeah, it's a good question. And yeah, that's a toxin that could be causing, problems. And yeah, that's quite a good question, why we're using toxin on kids. But the thing is, we don't really have anything to treat those kids with, because, you can give oral medication, but that has quite many side effects. You can insert a pump and have that medication going, but still has quite many side effects, and you have to treat those kids. Since it's used for almost 3 decades, we have quite many experience with that, and they are safe to use. So we know the concentration, and it stays there. It's quite safe to use. So yeah, good question, but it's working.